Hi, Dr. Sandeep. My aunt has completed her treatment for breast cancer. Can you please give us a few tips on how to prevent its recurrence?
So, now that you have undergone all the treatment, it is important to understand how to reduce the risk because you don't want to come back with the same disease. You want to be a winner. So, how do you do it? There are a few key factors which you have to keep in mind when we talk about recurrence. Now, of course, there is a disease factor, which is the behavior of the disease itself, because some cancers are aggressive. Two, there is the treatment factors, because there can be something wrong with the treatment itself. And the third is the patient factor, that is what you can do with yourself that can avoid recurrence. Now let us list out the things which could contribute to a healthy survival. Number one, your own mental status, that is your emotional stability. So this is very, very important, because if you are depressed, if you don't feel healthy, your body does not behave healthy. Your immunity is not very good. So a healthy mind will keep it going much longer. So what do you do for this? You can always practice yoga, you can practice meditation, you can do many other things which help you keep your balance, keep yourself engaged with something which you like, continue to do your work. So all these things will keep you healthy and fit. 2. Take care of yourself physically. Now, how can you do that? Exercises are extremely important in this. Apart from this, you need to look at your habits. Smoking, alcohol, these are the things which can really harm you, and you have to keep away from these and keep yourself healthy. 3. Eat healthy, because diet is very important. What is eating healthy? Eating healthy means that you take plenty of green leafy vegetables, you take plenty of fruits, avoid red meat, take plenty of proteins. All these things contribute to a healthy diet, and that will make you survive better. Reduce stress. It's very important, because stress levels increase the insulin level, it increases the steroid level in the body, it increases the harmful chemicals in the body, and thus can lead to increase in the incidence of recurrence. So avoid it, keep your mind calm. Limit alcohol intake. It is very important, because alcohol has been linked to breast cancer. So taking alcohol could lead to an increased incidence of breast cancer recurrence. Exercise regularly, and at least a 30-minute walk or 30 minutes of regular daily exercise will keep you away from recurrence. Apart from this, what is very important also is to follow the instructions given to you. That is, always follow a screening. In fact, remember, it is not just the breast cancer which is very important to you, because very often people think I got breast cancer, they don't think in terms of other cancers. So a screening which will detect other diseases, all the other chronic diseases including critical illnesses like cancer, has to be performed every year. Because you could get a heart disease, you could get any other cancer in the other parts of the body, you can have many other diseases. So you should not forget those. So for that there is screening, or what we call as a health checkup, annual health checkup. Do follow an annual health checkup in order to get or be ahead of the disease, so that it does not catch up later, it can be prevented and diagnosed early. Maintain healthy weight. In fact, obesity is known to increase the risk of breast cancer and colon cancer as well. So it is very important that you look at your health in the form of your weight. So maintain within the healthy range, and that works a long way for many other diseases as well. Today, the vitamin D levels among most of our population is very low. In fact, because many of us don't venture into the sunlight. So what is to be done? You need to look at vitamin D levels. Interestingly, I am telling you this because there have been some studies which have shown a link between low vitamin D levels and breast cancer. Is there a direct link? We don't know, but there are some studies which have shown that. So look at your vitamin D levels. If it is low, look at replacing that. The last of the points in this is you should stick to the therapy that is given to you. Now that you have completed all the intense form of the therapies like the surgery, chemotherapy, radiotherapy, so there could be a targeted therapy or endocrine therapy that is left behind for you because you have certain factors in your cancer. That is the positivity of hormone receptor or a HER2 positivity. So if you belong to that type of cancer, the doctor would have advised you to take one of the hormone tablets or target therapies. Now stick to these. Just because your intense period is over, don't stop your treatment. Continue to take these treatments as long as you have been advised. The hormone therapies have been shown to be advantageous even up to 10 years. So it is recommended to continue for that duration. We have seen a great advantage in many of the research studies that has been published. So if you follow it, your risk of recurrence could be significantly lower. So these are the 10 points which are very important in reducing the risk of breast cancer recurrence. All the best.